Hi, everyone. Today I'm extremely excited to be speaking with Dr. Audrey Wells. Dr. Wells is a seasoned sleep medicine physician and a professional mindset coach. She is on a mission to help people with sleep apnea get fully treated without sacrificing comfort. She offers a comprehensive library of self-directed courses, a group coaching program, and a private Facebook community. There are also free educational resources and more on our website, supersleepmd.com. So, Audrey, thanks so much for joining me, and I really appreciate your time in talking about this important topic of sleep.
I'm happy to. This is something I'm really passionate about.
Yeah. I've been wanting to talk about this for a while. I think that in my practice, which is more of a overall holistic practice, sleep does have an important component. Obviously, this is what you deal with day in and day out. Um, but it's an area where there's a lot of interest now, and I think that there has to be, more clarification, more information out there about um, the details of sleep, the details of sleep apnea, and so that's what I'm excited to hear from you about today. So, I want to dive in and first ask you a little bit about your background and what brought you to medicine and specifically to sleep medicine.
Yeah, sure. I'm actually not one of those people that knew from age 5 that they always wanted to be a doctor. I didn't make the decision until I was finished with college, actually, to go into medical school. And it's something I took really seriously. I think being a physician is an incredible privilege, working with people and um, dealing with their health, both mental health and physical health. And that's something that really appeals to me from a sleep perspective because sleep is for the entire body. It's for your mind and it's for your physical body, your brain, and everything below it. So, yeah, I practice sleep medicine full time. I've been doing this for about 15 years. I like to say I'm a sleep medicine physician. I'm not a sleep apnea physician.
Hmm.
There's lots of sleep diagnoses out
Yeah.
there. But sleep apnea tends to be the most common thing in insomnia, actually, with um, the kind of patients that I see. And it is sort of a comprehensive approach to a
Hmm.
person and their health because sleep affects everything.
Yeah. And that's what, when we connected, I think one of the main, things I found so intriguing was that you're also a mindset coach and you're also, using this holistic approach, which we oftentimes don't see. We oftentimes have this compartmentalized approach to care, which is either you're doing all of the more conventional Western medicine type of modalities, or you're doing an entirely alternative side of things. And so it's really great to find physicians that are combining both. I think that's very important. So I definitely appreciate that about you.
Thank you.
So if I was to ask you what is in just basic terms, what is good sleep? What would be the main things that you would incorporate into that into good sleep?
I think good sleep is prioritizing your sleep and maintaining a regular sleep schedule. If I had, just two main points to deliver today, those would be
Hmm.
them. So, prioritizing your sleep is prioritizing your self care.
Yeah.
And a big part of that is regulating the time that you go to bed, in addition to your bedtime activities leading up to that and then holding your wake up time consistent, even 7 days a week, which is, it's tough with a lot of folks to maintain that with all the things going on. But the wake up time tends to be more important than the bedtime, and it gives your brain an anchor to
Hmm.
make your sleep and your wake more predictable and high quality. So you know that you're getting good sleep if you have alertness during the day.
Hmm.
And for most people, there's a couple of alertness peaks. So one is going to be in the late morning time, and then the other in the early evening time. And there's a natural lull
Hmm.
in alertness in the early afternoon. Nothing to do with your lunch or how
Hmm.
big your lunch is, but the circadian rhythm does take a dip at that time. So if you feel alert and awake during the day, you can say with some degree of confidence that your sleep is on target.
Mhm. Are you a proponent of sleeping at a certain time versus are you more concerned about how the length of time people are sleeping for? In other words, someone says I'm going to sleep from 12 to 8 versus 10 to 6. Would you recommend them sleeping 10 to 6 versus later?
I think part of that depends on a person's genetic preference for their sleep window. So you've probably heard of larks and owls and this idea of
Hmm.
having a chronotype. So a lark is an early bird, someone who prefers to go to bed early. That would be maybe 10 p.m. in your
Hmm.
example,
Yeah.
waking up at 6 a.m. and really feeling their best
Hmm.
with that sleep schedule. Whereas an owl is going to be going to bed much later, maybe 2 a.m., and waking up at 10 a.m. if we assume an 8 hour sleep
Hmm.
schedule. Most people are actually third birds. About 65% of the population falls into this third bird category where their bedtime is somewhere around 11 p.m. to maybe midnight or 1, and then wake up time is somewhere in the 7 or 8 a.m. time
Hmm.
frame. So aligning with your chronotype will allow you to have better quality sleep.
Hmm.
And that's, I would say, has a slight edge over sleep total time. So if your
Right.
sleep quality is excellent, then you can err a little bit with the sleep quantity.
Okay, so not one size fits all. Just
Correct.
find what's individually right for you. Good.
Yes.
And we've talked a lot about stages of sleep. So for the person that doesn't know too much about the stages, are you able to go into a little bit about how many stages of sleep they are and what is their relative importance?
Sure. I like to talk about this in a way that's consistent with what a lot of the wearable devices
Hmm.
show.
Yeah.
So the wearable devices will typically show a period of light sleep, a period of deep sleep, and REM sleep, rapid eye movement,
Hmm.
or dream sleep. Sort of under the light sleep umbrella are two stages of sleep that are monitored on an overnight sleep study, for
Hmm.
example. So you have non-REM 1 sleep, which
Hmm.
is transitional sleep, very light. And in a person with a healthy sleep pattern, non-REM 1 sleep makes up a very small percentage of the different sleep stages. So
Hmm.
typically around 5% or
Okay.
so. The other non-REM sleep stage in light sleep, according to wearable devices, is non-REM 2 sleep. And this is the majority of the sleep stage that a person would have in any
Hmm.
given night,
Right.
usually a little above 50%. Then deep sleep is sort of equivocal to non-REM 3 or slow wave sleep. This is the stage that's very important for moving short term memories into long term
Hmm.
storage. And recently, there was a really exciting discovery about another function of slow wave sleep, which is that there's this entire glymphatic system in the brain, which acts as sort of a uh, detoxification
Hmm.
occurring at night during slow wave sleep. So, really important to get that. And then REM sleep or dream sleep is where you have the dreaming, where you can sort of follow along the story and report it to
Hmm.
someone the next day. Dream sleep is actually really important for emotional processing.
Hmm.
So, people who are short on dream sleep may tend to feel more irritable or feel like their emotions are um, quite prominent during their day to day life. Interestingly, there's kind of a slant towards non-REM 3 sleep in the first half of the night. So you'll
Hmm.
experience relatively more non-REM 3 in the first half of the night, even though you're still having 90-minute sleep cycles with all of these stages. And then in the second half of the night, the preference is for REM sleep or dream sleep. More REM is in that second half of the night.
That's, yeah, so important to know. That way you can um, just being aware, I think, is the first step in getting much better sleep. So um, now, when you look at sort of the amount of time you spent in each, are you thinking more in terms of a percentage? If something, if someone is wearing a wearable device, then you want to aim for a certain percentage, like the ones you mentioned, to 5% to 50%, and so on. Is that the right way to look about it?
You know, the wearable devices are not entirely robust at
Hmm.
defining sleep stages at this point. I think that technology will improve with
Yeah.
time, but wearable devices are really taking a bit of a guess. And so I wouldn't say, you know, it's worth hanging your hat on
Hmm.
the relative percentages of the different sleep stages. However, I like two things about wearables. First off, they give you feedback and people check them.
Hmm.
I certainly do. I think
Yeah.
it's fun to kind of look at what your sleep is doing. And that highlights the importance of sleep and kind of
Hmm.
gets it on your radar every
Yeah.
day. And I think people really benefit from that.
Hmm.
Secondly, wearables are really good at determining the onset of sleep at the beginning of the night and the
Hmm.
offset of sleep when you wake up and start your day. And so this allows you to see how much total sleep time you're getting.
Right.
And again, I think that's super important. At this time, working Americans are only getting enough sleep about 66% of the time. About a third of people report short sleep,
Hmm.
and that's a big problem.
Yeah, absolutely. So to that point, if someone comes to you and, if we put aside for a second the sleep-related breathing disorders like sleep apnea, but someone is coming to you talking about sleep hygiene, right? What are the
Mhm.
top kind of tips that you have for sleep hygiene? What would be your response to them about ways in which they can improve general sleep?
The holding the wake up time
Hmm.
consistent is my number one tip, for sure. And really making sure that you've got enough time allotted for sleep. So you're not
Yeah,
pinching at the night or pinching in the morning.
right.
You know, people oftentimes squeeze their sleep in order to be more productive.
Hmm.
But because the brain is so dependent on sleep for learning, for memory, for creativity, and problem solving, the
Right.
net effect is not worth it. So it would be better just to allow enough time for sleep.
Hmm.
I also think it's really useful to look at how your day and night have contrast.
Hmm.
So you definitely want to have more physical activity during the day
Yeah,
as a signal to your mind that it's time to be awake.
yeah.
And then at night, there's a wind down period where you're
Hmm.
less physically active or doing some stretching. And that's a signal to your brain that we're slowing down. It's
Yeah,
time to sleep now. Same with social interactions and same with light. So, bright
right.
light exposure in the day, preferably the sun, if you can do that. But I'm in Minnesota and we don't see the sun this time
Right.
of year. So, frequently I'll just do some light exposure with some artificial light, full spectrum,
Hmm.
10,000 lux.
Hmm.
At night, dim lights are important because that's going to allow your brain's pineal gland to produce melatonin.
Yeah.
If you're exposed to bright light at night, that's actually inhibiting your body's production of melatonin, and that includes electronic screens. Got to put those away.
I was just going to mention that, and that's probably the hardest thing for people, and us included. So it's just very difficult to get away from that, especially if you have young kids and you're just trying to, they've gone to sleep, and then you're trying to do something, watch something, and so yeah,
Is
that
that your
can be.
experience?
That is my experience. Yeah, I think my wife and I, the only time that we really have is that time after they go to sleep. And so, I think you have to be very purposeful and you have to do it with, a strong habit to put away the electronics and not allow yourself just to get a little mental relaxation and just scroll or something like that. So, yeah, it takes a lot of, purposefulness. Yeah.
It's really true. And I'm glad you brought up the idea of a mental break because electronic screens work against your sleep in two ways.
Yeah.
One is that they have a short wavelength blue light that's
Hmm.
emitted. And again, that light exposure is giving your brain the signal that it's time to be awake.
Right.
So even if you fall asleep pretty quickly, your sleep could be choppy because
Hmm.
of that mixed message. And then the second thing is electronic screens are typically tied to some emotional agitation, either
Hmm.
because you're doing work or you're on
Yeah.
social media.
Yeah.
You know, those types of things kind of get you revved up and you can have emotions that are not compatible with sleep, and that's a problem.
Yeah. I really like that word emotional agitation. I think it really hits the nail on the head in terms of what's going on. So now, we talked a little bit about the wearable devices. You mentioned how their technology isn't perfect at this time, and that's understandable. In terms of the specific ones, if someone asks you about, let's say, the WatchPat 1 device or the Night Owl device, is there one that you recommend more or you personally use and find much better than the others?
I'll draw a distinction first between consumer wearable devices and home sleep apnea tests.
Yeah.
So the Night Watch and the Watch Pat are home sleep apnea tests, which are used for diagnostic
Hmm.
purposes. They are only good at testing sleep apnea, so they do
Yeah.
not test for any other sleep disorders. And I think that's really important to highlight because many times folks have more than one sleep disorder.
Right.
So if it's positive for sleep apnea and you're treated, but you're still not feeling like your sleep is where it should be, a coexisting sleep disorder could be present.
Hmm.
The home sleep apnea tests are also only useful if they're positive. They have a
Hmm.
tendency to have a relatively high false negative rate. And so if you have a home sleep apnea test and it comes back with a negative result,
Hmm.
that does not necessarily mean you don't
Right.
have sleep apnea. At that point, the recommendation is to go for an in lab sleep study, which is a much more accurate and comprehensive test. In fact, it's the gold standard for sleep testing.
And
Um,
you recommend? Oh, sorry. Go ahead.
I wanted to say that some people say home sleep testing, but I always like to just make that small correction. It's home sleep apnea testing,
Yeah. Yeah.
nothing more. Yeah.
Yeah. That clarification. So, in your patients, are you sending them straight to get a in-lab sleep test done?
You know, these days it oftentimes depends on their insurance company.
Yeah.
Some insurances mandate that the home sleep apnea test is the first testing
Okay.
measure.
Hmm.
And truly, you know, since the pandemic, they're much more common. I think for the most part, people prefer them because they get to sleep in the comfort of their own home. And there are still sensors involved, but it's much fewer than an in lab
Mm.
sleep study.
Yeah.
For example, there's nothing on the scalp, but that creates a bit of a blind spot
Hmm.
because the sensors on the scalp that you get with an in lab sleep study objectively determine your sleep stage.
Yeah.
So when I read an in lab study, I can tell for sure when a person's in dream sleep. Whereas a home sleep apnea test is making an educated guess.
Hmm. Okay. So, putting the sleep apnea tests both in home and the more comprehensive in-lab sleep tests aside, in terms of the wearable devices we were talking about, would you think of like the Aura Ring and other devices like that in terms of
Um,
tracking sleep?
yes. So just to name a few, there's Aura Ring, there's Fitbit
Hmm.
has a tracker. There's the WellU ring, which is a blood oxygen monitor, a continuous blood oxygen monitor
Hmm.
that's now available for consumer use. Garmin has a product. And relatively recently, there was sort of a head-to-head comparison with these consumer wearable devices
Hmm.
against an in-lab sleep study to sort
Hmm.
of see which ones were the best.
Yeah.
Fitbit came out ahead, and
Oh,
Garmin was the worst.
okay.
Yeah, and I think Aura was up there too. I actually use an Aura ring, and I like it because it keeps its charge for a long time, and it's really, I don't wear a watch, so
Hmm.
it's really doesn't, slow me down just on my finger. One thing that I really like seeing with these consumer wearables is a measure of heart rate variability. Is this
Mm.
something that you've heard about?
Yeah, certainly.
Yeah, so heart rate variability gives you a sense of what your parasympathetic tone is.
Mm.
So that's important in our stressful lives, where for a lot of people, being in that fight or flight mode is more common than rest and digest. So
Yeah.
it's a bit of feedback that can help you slow down and prioritize your wellness and manage your stress.
Yeah, very important point. I think not enough people realize that, and we get so caught up in our busy lives, especially as physicians, and don't all oftentimes look at that parasympathetic rest and digest system. So,
Yeah.
um, now switching gears and coming more towards actual sleep apnea or sleep-related breathing disorders. For the person that doesn't know what really sleep apnea means, can you define that term and what that looks like on a sleep test?
Yeah, for sure. Sleep apnea is a huge problem in the United States. Currently, there's about 6 million people diagnosed with sleep apnea, but estimates are that about 80% of people who have sleep apnea are undiagnosed.
Wow.
So there's a huge undetected disease burden out there. And I think, when you look at the term sleep apnea, the sleep is a familiar word, but apnea, what does
Hmm.
that mean?
Right.
It literally means stopping breathing. And
Yeah.
I like to characterize sleep apnea as a breathing disorder, not a sleep disorder,
Mm.
because then it gets the attention it deserves. So, COPD, asthma, pneumonia, these are breathing disorders.
Yeah.
So is sleep apnea, and you want that treated. So, it occurs only during sleep, obviously. And when you talk about sleep apnea, most of the time you're talking about obstructive sleep apnea, which
Yeah.
is the most common type.
Hmm.
So it's a repeated obstruction in the airway
Hmm.
due to collapse of the soft tissues in the back of the throat. And it's a multi-level collapse. So the collapse might occur sort of higher up in the back of the nasal cavity, at the level of the tongue, or
Hmm.
just below the tongue. So it's a
Okay.
multi-level collapse where you stop breathing for at least 10 seconds, and the end of that is going to be because you had an arousal to
Yeah.
breathe,
Hmm.
or your blood oxygen level dipped, and that signaled an emergency to your
Hmm.
brain. So you wake up a little bit, you take some recovery breaths, but then when you go back to sleep, you're vulnerable to that airway collapse again.
Mm.
So for a person who has moderate sleep apnea, that is at minimum 100 airway obstructions per night in a 7 hour sleep period.
Yeah.
So you stop breathing 100 times at
Yeah.
night.
And then
Big
that's a
problem.
shocking amount. Yeah. Yeah. When you think about it.
Yeah.
Um, so can you speak a little bit to the AHI, the apnea hypopnea index that people can look at or that's what diagnoses sleep apnea on the test?
Yes. At this time, the primary diagnostic measure for sleep apnea is the AHI.
Hmm.
So, apneas, which are complete airway obstructions or stopping breathing, hypopneas, which are a partial airway
Yeah.
obstruction, followed by either a drop in blood oxygen or an arousal from sleep. You mark all of those throughout the sleep period, add them all up, and then divide by the total hours of sleep.
Hmm.
So what you get is airway obstructions per hour of sleep. And what I mentioned at the 100 stopping breathings per hour or per night would
Hmm.
be 15 airway obstructions per hour. Your AHI would be 15.
Hmm.
The AHI also determines severity.
Right.
So less than 5 airway obstructions per hour is going to be normal.
Yeah.
5 to 14 is mild sleep apnea. An AHI of 15 to 29 is moderate sleep apnea.
Hmm.
And then 30 and above would be severe sleep apnea.
Severe. And really, anyone above 5, are you recommending a CPAP for them, or what is your general approach to when they get diagnosed with it?
Yeah, that's a great question. And I think anyone who has sleep apnea needs to know where their AHI is because it definitely informs their treatment choices and predicts the long-term effects when their sleep apnea isn't treated.
Hmm.
Here's what I mean. Data shows that if your sleep apnea is in the moderate to severe range, there is a very high correlation with things like heart disease,
Hmm. Yes.
Alzheimer's, metabolic dysregulation, including risk for type 2 diabetes.
Hmm.
So, moderate to severe needs to be treated. The gold standard treatment is CPAP therapy.
Yeah.
Things are a little ambiguous in the mild range, and especially right now with the CPAP shortages and there's problems with supply. There was a big recall of CPAP machines in the last couple of years by Philips Respironics. So mild sleep apnea has more treatment choices, and the mild nature of the sleep apnea does not necessarily have a strong correlation with long-term negative health
Hmm.
outcomes. However, there's not necessarily a correlation with the degree of sleep apnea and the symptoms.
Hmm.
In other words, a person can have mild sleep apnea and
Yeah.
be very, very sleepy. So they're not working well, their
Hmm.
relationships are suffering, they have trouble driving. Even though they just have mild sleep apnea, I would certainly recommend treatment for that
Hmm.
person. On the other hand, I have seen a number of folks who have very severe sleep apnea and they don't seem too bothered by it.
Hmm. Okay.
We don't understand this fully yet. It does seem that different people have different tolerances for that sleep disruption.
Okay. And what are some, because I know that obstructive sleep apnea or OSA gets all of the sort of the limelight, let's say, when it comes to sleep-related breathing disorders. What are some of
Yeah.
the other ones that you see that people might not be as aware of in terms of the actual sleep disorders?
Yes, obstructive sleep apnea is sort of the bread and butter of sleep apnea. Other types include mixed sleep apnea, which is
Hmm.
going to be a combination of obstructive sleep apnea and central sleep apnea. There's pure central sleep apnea, which is often connected to a neurodegenerative disorder or things like heart failure. And then there's a complex sleep apnea, which I'll explain in a minute. So,
Hmm.
central sleep apnea is a situation where there's a pause in breathing during sleep, not because you've blocked off your airway, but because the signal to breathe from your brainstem to your diaphragm has become interrupted or is
Hmm.
delayed for some reason. So, central sleep apnea is a pause in breathing without that effort or that obstruction to overcome.
Right.
And then mixed sleep apnea is when both obstructive and central coexist. Complex sleep apnea is a little bit of a tricky situation. So, this is when a person has obstructive sleep apnea, they're prescribed CPAP therapy, and the treatment induces those central apnea events.
Mm.
Now, most people, if they persist in using CPAP, will go on to resolve those central apnea events. And it's probably a loop gain situation where the carbon dioxide is a little bit lower for a time, and then there's a recalibration that allows those central apneas to disappear. But we do see that from time to time when a person is treated for obstructive sleep apnea.
Yeah, and I'm glad you mentioned that because one of your passions is also the people who come to see you who, despite having the diagnosis and despite using the CPAP, are still struggling with their sleep. And I think
Yes.
that, in getting caught up with all the diagnoses and the initial treatment, we're not really focusing on what about those patients that are already on a CPAP. So what is the best way to approach that? Because sometimes, you know, and I'll probably ask this after, but about, the other modalities that we have to treat and, some of the newer ones that are gaining more popularity. I certainly want to know the validity of them. But
Mhm.
just first to ask you how to deal with those patients that are, despite their sleep apnea, still struggling with, or excuse me, despite their CPAP, still struggling with sleep apnea symptoms.
When a person gets evaluated for their sleep or sleep problems,
Right.
there's, I think there's a hope that the problem will be simple, the fix will be
Hmm.
simple, and the results will be profound.
Yeah.
And unfortunately, there's quite a number of folks who get the diagnosis of sleep apnea and start CPAP, and things don't go as they had hoped.
Yeah.
So, a few possibilities exist. One is that when you're using CPAP to treat sleep apnea, ideally, the treatment would be in place throughout the entire sleep period. And
Hmm.
there's a misconception that exists that CPAP is only necessary for half the night or 4 hours of usage per night. That is a byproduct, I think, of the insurance minimum for compliance.
Hmm.
And people sort of target that in their mind as checking the box for CPAP use. However, when you only use CPAP for the first part of the night, it
Right.
means your entire sleep period in the second half of the night is untreated, your sleep apnea is
Hmm.
present, and your REM sleep, which is a stage in which your muscle relaxation is most profound, so you're most likely to obstruct the airway, your REM sleep is untreated. So that's some low hanging fruit. If you can use your CPAP machine throughout the entire night and fully treat your sleep apnea, that may help you to feel better.
Hmm.
Another consideration is that as a result of the pandemic, most folks were tested with a home sleep apnea test.
Hmm.
If sleep apnea was found, CPAP was prescribed, but they're
Right.
still tired. I just like to recognize there's a blind spot there. We don't know if that person has another sleep disorder that
Hmm.
coexists
Yeah.
with the sleep apnea, and it's not uncommon. So, in order to flush that out, an in lab sleep study may be needed.
Hmm.
And I think, thirdly, there's just lots of causes of tired, and
Yeah.
it's sometimes hard to differentiate between tired and sleepiness. So, I actually created a course just to address this in a very comprehensive way,
Yeah.
and it's called How to Finally Sleep Better and Feel More Awake. It's for CPAP users and it's for non CPAP users because I think, you know, people have invisible burdens, for example. There's
Yeah.
mental fatigue, there's social and emotional fatigue,
Hmm.
there's physical fatigue, such as having chronic pain.
Yeah.
These things are tiring. And even if you're a very faithful CPAP user, looking at that prism from a different angle may yield some sort of action step that would help you to feel better during the day.
Mm. Yeah, such great information, and I appreciate you sharing that. So to ask you now just about some of the newer, more popular, let's say treatment modalities that people are talking about. I know there's mouth taping, for example. Is that really something that you find is has good data backing, or it's still too early to know that?
There have been some smaller studies, not hugely rigorous, looking at mouth taping and its effects. So the idea is when you have an open mouth, your jaw
Hmm.
goes down, and even that small movement causes a slight crimp in the airway, so
Hmm.
to speak.
Right.
So for some people, that's going to increase snoring. For others, it's going to tip them over into the range of sleep apnea, typically mild sleep apnea.
Mild. Okay.
So, mouth taping sort of gives a little support to the jaw to keep that
Hmm.
up and thereby increase the airway caliber just a tiny bit. So if you have moderate to severe sleep apnea, mouth taping is not going to help you if that's all the treatment that you're using.
Yeah.
Um, the data is a little bit skewed or unclear for mild sleep apnea. In some individuals, it can help. And it does seem to help a bit with snoring. It promotes nasal breathing, which I love. You should breathe through your nose
Hmm.
all the
Hmm.
time.
Right.
The mouth was simply not made for breathing. So taping keeps the mouth closed, and people then start to work out how they could breathe through their nose more. I like it for that reason.
Okay. Okay, good to know. Because it's sometimes it's hard to know what is just more of a fad and just being is just more popular online versus what really has good backing. So it's good to
Yeah, I I would say mouth taping is a pretty light treatment for
yeah,
whatever issue
yeah.
you've got going
Yeah, and
on during
relatively
your
harmless, inexpensive, and so
true.
yeah. And are there any other similar to mouth taping, any other treatment modalities that we may not be familiar with that exist in your world?
For sleep apnea,
Hmm.
yes, there's actually quite a number of treatment alternatives, and I have done a review of all of them. So, one example is oral appliance therapy, which is
Right.
also known as having a mandibular advancement
Hmm.
device.
Hmm.
Now, this is not the boil and bite mouth guards that you can
Yeah.
buy over the counter or order on the internet.
Hmm.
Those things can actually make sleep apnea worse, so I
Hmm.
definitely don't recommend those.
Okay.
But the oral appliance therapies, what they are is a mouthpiece. It's custom made by a dentist. The dentist should be experienced in dealing with sleep apnea and also have special training in sleep apnea. That dentist would be able to do a fitting of this appliance if it's over your upper teeth and custom fit over your lower teeth as well. So you have to have a number of
Hmm.
original teeth in order to support it. The upper and the lower pieces engage to bring the jaw forward. Sometimes
Hmm.
it's with rubber bands or springs or even a clasp in the front. But bringing the jaw forward helps open up the airway caliber just a little bit.
Okay.
The oral appliances are interesting because they can be a really solid CPAP alternative if your sleep apnea is in the mild range.
Hmm.
And I would say, for me personally, I've had success giving folks with mild sleep apnea the choice oral appliance or CPAP. You decide,
Okay.
and then we'll retest after the oral appliance to confirm. Because if you don't retest, you don't know. So
Hmm.
that's an important follow up. The oral appliances also can work for moderate sleep apnea and even
Hmm.
some severe cases, but there's no good way to predict that. So if it doesn't work, the patient may not be happy because sometimes there's a significant out of pocket cost to
Hmm.
go down that road of the
Sure.
oral appliance. Another alternative therapy are surgical approaches to sleep apnea. Now, these are not first line treatments,
Right.
and historically, the most common one was called the uvulopalatal pharyngoplasty.
Hmm.
Huge
Yeah.
mouthful. U triple P is a funner way to say it.
Right.
But this involves cutting out the soft palate in the back, just sort of trimming it, taking out the uvula.
Hmm.
And the idea was it's sort of a debulking procedure to open
Sure.
up the airway. Unfortunately, it's a very painful procedure. It was only successful about 40% of the time.
Right.
And in some cases, the way that tissue scarred sort of pulled down the soft palate and made it
Hmm.
quite inflexible.
Okay.
So the person still had sleep apnea, and now they needed a higher CPAP pressure to hold that airway open because of the inflexibility. Fortunately, there's some other procedures coming out. People always want to know about the Inspire procedure.
Hmm. Right.
Yes, their marketing game is very strong, and I think that I like to get in the role of saying, what would I advise my family member to do?
Hmm. Hmm.
And if CPAP is not working for you, if you can't tolerate it, and you might be an Inspire candidate, that does seem to be a viable option. But there's many criteria that you have to go through in order to confirm your candidacy for Inspire. I'll give you some examples. One is your sleep apnea has to be in a certain level of severity. So it's above 15 for the
Yeah.
AHI, but below 65.
Mm,
So
okay.
if you're very severe, having airway obstructions more than 65 times per hour, then you're not a good candidate. There's also a weight restriction. So I think it's 35 for your BMI, body
Hmm.
mass index. 35 and below, you could be an Inspire candidate.
Hmm. Okay.
Most of your airway obstructions have to be obstructive. You can't have more than 25% central sleep apnea events. And you have to go through a sedated endoscopy. So they look in your airway to make sure you're having an airway collapse that looks like
Hmm.
this versus a concentric
Mm.
collapse from
Okay.
all sides. There's a lot of steps, and I don't think the advertising quite highlights all of that.
Sure.
So getting educated even before talking to your sleep apnea specialist or your sleep medicine doctor is going to behoove you so that you don't waste that appointment. Another thing I'll point out is you have to have a sleep study in the last 2 years to confirm that you're still a
Right.
candidate. So some people, it's been quite a while since their last sleep test.
Mhm. Yeah, that's fascinating. I mean, that's obviously the Inspire procedure is something on a lot of people's radar just because they've heard of it so much. So,
Yes, yeah. It is a surgical procedure. You get a 2-inch scar on your right chest. You get a
yeah.
2-inch scar under your throat. And there's a pacemaker-like device that's inserted. They thread the electrode up into the base of your tongue,
Hmm.
and it causes your tongue to push forward with each breath that you take. Now, the efficacy is not 100%. And sometimes you still snore, even with the Inspire device in place. So I think getting really clear about the expectations
Hmm.
is important so that, the outcomes psychologically and physically can be maintained.
Yeah. So this has been such a great conversation, and I appreciate you giving all of your wisdom and expertise on this topic. What are the main takeaways that you would like to give the audience regarding sleep and everything we talked about?
Mm. I'd really like people who are listening to prioritize their sleep. And sort of a natural side effect of that is looking at your daytime activities and stress levels and
Hmm.
time management in order to sort of up level your life and your personal well being. I think that's really key to being your best self. And I want to put on everybody's radar the idea that sleep apnea may be existing for you or someone that you love. Women in particular have a susceptibility to being underdiagnosed
Hmm.
because they don't necessarily present as snoring like a bear or
Yeah.
falling asleep at the dinner table, for
Hmm.
example.
Yeah.
Women present differently. So if you're a woman and you have sleep issues or daytime tiredness, it's
Hmm.
worth getting that checked out.
Very important point. Yeah. Yeah, absolutely. Great. And your website is supersleepmd.com, right? Just to
Correct.
remind people. So if they need to find you or get more information about everything that you're mentioning in your course, I will direct them that way.
Sounds good. Thank you.
Yeah. Yeah. Well, thank you so much, Audrey. It was great speaking with you and getting all this really, really important information. I look forward to hopefully doing this again where we can talk about other sleep related topics because it's such a big area and it's sometimes just one sitting doesn't do it all the justice it needs. So I look forward to that, but I really appreciate your time speaking with me today.
Happy to do so.